Well, welcome back to Balanced Health. Joining us now is Dr. Vineet Shah, an orthopedic surgeon who is fellowship trained in hip and knee reconstruction and replacement. Welcome to our show. So glad you joined us.
Thank you very much.
And those statistics I gave those statistics I gave earlier blow my mind. That's how the increase in these joint replacements. Why is that?
It is interesting. You know, arthritis has become the most prevalent chronic disease process in the country. Currently, we have 46 million people suffering from it, and like your projections, you gave some numbers in 2030, but in 2020, we'll have 60 million individuals suffering from this problem. It costs us annually in the health budget $128 billion of cost. You mentioned baby boomers being on the high flow. You have greater than 50% of individuals less than age 65 with arthritic problems. So that is one of the reasons to your question. Why are we seeing more of it? You have people living longer, being more active.
Okay. But if I could just interrupt for 1 second. Again, I thought being more active would help you. You know, that you keep the joints moving, you're less likely to develop arthritis. I thought that more baby boomers were needing replacements because they just wear their joints out. So is there
and you're right, when you say that they wear their joints out, a lot of times wearing the joints out is being active, doing different, people are doing a lot of extreme sports, different sports where they're taxing their joints. They're having some injuries along the way, and eventually that's causing problems that leads to arthritis.
But when we talk about the macro view of this whole thing, the high velocity sports, the high impact sports still has to be a micro contributor to it. I mean, we're talking an increase of 20 million people. There's obviously a bigger thing. Aging is one thing. Is there a better diagnostic thing? Did they just complain less years ago, and now they're saying, wait a minute, you know what? My knuckles shouldn't hurt. I'm going to go have this looked at. I mean, do we have better diagnostic tools?
I think it's a multifaceted approach. Absolutely. I think people's attitudes may have changed over the years. People are not as tolerant to pain as they used to be. But the main thing is, not only is it activity, but the overall body shape, size, obesity. These are problems that are now also contributing. Age, people are living longer, so then arthritis, progress, longer life, longer use of joints, heavier individuals, active in certain ways in terms of sports and things like that, is leading to arthritis and also better diagnosis in terms of x-rays and availability of...
Well, you just pushed the hot button with me, because the obesity thing, on that notion, I always use this example when I talk about this. I remember when we went and saw General Grant's mansion, as it were, out in Galena, and his uniform was laid out on the bed.
Yeah, oh, I remember that. I was there too.
Yeah. So he wasn't in it, thank God. It was tasteful. But so my kids say to me, Dad, was that his son's uniform? I said, no, that was General Grant's.
That's his, yeah.
So we went on to do some research and so on and so forth. And the average height of the American male back then was 5'7". That was average. And the average weight was 145 pounds. From our perspective, being a health activist, I'm convinced that all the hormones that our animals are given, the growth hormones, are making us a bigger race. And I don't think, I'm going to go back to the creation part of it, I don't think that God created a body, the joints, to support structure this large. Am I a whacked out herb guy, or does this have any science?
You're absolutely correct. I think the general anatomy, the size of people has just increased over the time. A lot has to do with how we eat, how lethargic we become, sitting in front of TVs. Our portions are large. And I grew up in Europe, and I saw the portions, and I go back and visit family there. It's a whole different way. They eat well, but the portions are different. They don't have a car taking them from their garage to the closest parking spot.
They walk.
At Dominic's or at Jewel or one of the grocery stores. They walk. They take the bus. They take the train.
Ride a bike.
Ride a bike, absolutely. You know, so the activity is lacking. Nutrition isn't appropriate. And from your perspective as a nutrition expert, that is one of the major factors and variables. Like I said, it's a multi-factor kind of situation, and you've hit a very important point. And that, just one more point on that, when myself as a joint replacement surgeon, people come who are morbidly obese and want a new joint, I have to remind them that God made our bodies a certain way to hold a certain amount of weight. and they want me to replace the joint, we've been trained to do so, but they have to realize that the chances of failure between a bone and a metal and cement is also that much higher, and people sometimes don't appreciate that.
So in other words, what you're saying is if a person is morbidly obese especially, there's a good chance that this joint is going to break or wear out quickly?
Absolutely. You know, that has been shown in terms of the plastic or the polyethylene that we have that is the bearing surface. One of the bearing surfaces, it tends to wear out a lot more in heavier people than lighter people.
Talking about the life cycle of an arthritis patient, from my knuckles are swollen or my elbows kind of killing me, all the way to joint replacement. Is it usually when, and I don't know at what point you start seeing patients, I don't know if it's just surgery is what you do, surgery only? So, yeah. Okay. So as a physician seeing them, is there future a foregone conclusion, or do you see times where the process of degeneration is reversed in people? In other words, can these doctors look at these people and say, in 6 years you're going to be looking at a new hip, in 4 years you're going to be looking at a new knee? Are we at that point?
Yeah.
I think we are. I think I'm able to tell my patients based on their problems at the current time, the level of arthritis that I see in the x-ray, the symptoms that they show, their body size, their activity level, putting everything together, I'm able to give them an approximate time as to when things could start getting bad, where we need to revisit the whole idea of replacing the joint.
Is there a prevailing mentality that says joint replacement earlier rather than later gives you better quality of life, or do you wait to the last bitter moment?
That's a good question.
It is a great question. The issue is, for a long time, we've always tried to push as later as possible because the longevity of the joint has a certain amount of limit. But
of the replacement
joint. The replacement joint. And I feel that, unfortunately, doing that, we're taking people to age 65, 70 in a miserable state of life because they can't do what they want to do. So if people come at age 55, 58, 62 with bad arthritis, I think it is a good idea to replace the joint, give them the quality of life, let them enjoy life.
Well, yeah, because when you're 75, your quality of life is going to be diminished even with a new joint, right? And the other question would be, are the new materials, and we're going to talk about these beautiful joints in a minute, but are the materials getting better so that there is longer wear on these?
Absolutely, and when we talk about that, I can expand on that a little bit more. We have metals against plastics. We have ceramic against plastic, ceramic against ceramic, metal against metal. A lot of different combinations, and plastic itself has developed.
Let's come back and expound on it.
Yeah, we're going to expound on that in a minute. But for more information, check out tln.com and click on shows and then Balanced Health, or call 888-242-9393 for a copy of today's show. And coming up in our healthy cooking segment, linguine with garlic and oil. Stay tuned.